Right, we're here with Aaron, and we're going to talk a little bit about anterior shoulder pain because Aaron, believe it or not, is a rock climber. He also studies massage and he's also working at bottle shop. So he's starting to overuse this shoulder a little bit. So his signs and symptoms are now starting to come through that anterior shoulder. So first thing that we want to do is try and test out his range of movement, see if we can't reproduce some of these signs and symptoms. So the first thing we're going to do is we're going to get Aaron just to come into a little bit of abduction for us. Okay, how's that feel when you go through there?
It's tight at the top.
Right, okay. Whereabouts do you feel it when you get to the top? Up through there, okay. So can I come through flexion? How's that feel going through that way?
That's fine, Stu.
That's okay? All right. So let's do a little bit of resisted. Hold that there. No. Just hold it there. I'm going to push down. Feel anything on that?
No, Stu.
Okay. And hold it that way.
No,
What about that? That's okay?
That's
Good.
fine.
So he's not provocative. That's great. But where he is getting some problems is when he puts it under load. So you've been rock climbing.
Yes.
When does it give you the most grief?
When I'm pulling up and in.
Okay, so up and in. And it's coming down through the anterior part of your shoulder. Is that where you feel it the most?
Yes, Stu.
Yep. Okay. So first thing we want to do is just sink into this tissue here, because one of the things that we see with anterior shoulder pain is it related to his anterior deltoid? Is it the subscapularis tendon or the long head of the biceps? Okay, a lot of the time you'll find that long head of the biceps is involved because obviously for what he's doing, he's pulling up and under, as he said, so you're going to get the most load through that long head of biceps. So I'm going to come into the side here, just pick up through that, almost the front of the anterior capsule. Okay, that's a bit tender there. That one's more so. So that's that long head of biceps. If I come out a little bit further, then we're into the bulk of that anterior deltoid. Okay, so looks like it's the long head of biceps. We sort of thought that beforehand. That's just confirmed us. Let's get you down, have a little bit of work on that biceps. Okay, so with a release technique for the biceps, one of the things that I do first is just to really engage with the digital ischemic pressure. So quite simply, once again, we get to sit for this. Once again, a little bit of pre-max cream. So just some broad massage across the area first. Okay. And what we can get to do, make sure that the elbow is bent. I'm going to come in with our forearm and we're just going to sink right onto the front of that shoulder. So make sure that we're sinking in. Now it's a really broad approach. So what I'm using is literally this whole area, okay? But the focus will be down more through here and I'm going to pick up that trigger point right over that sort of transverse humeral ligament. So let's just sink down. And then I'm going to sort of basically nestle right onto that tendon there. You feel that there?
Yes, Stu.
So what you might need to do is just push up a little bit superior, lateral or medial to pick up that trigger point. So we want to really reproduce whereabout he's getting that sensitivity, okay? Once we've found that area, which is about
Everywhere,
about there, yeah, it's quite tender, isn't it? So he's got a big generalised area of tenderness. So the idea is to just sink in that area and just hold that pressure that he can handle. We may need to sit here for about a good minute or 2 minutes sometimes longer, it depends on the person. And as one area starts to soften off and dissipate, then we move a little bit more to either the lateral or the medial or even inferior, so that obviously what we're doing is we're just encompassing a whole area of tenderness. I can feel that there. That's starting to dissipate a little bit.
Yes.
Yep. So as that dissipates, I'll move a little bit more over to the lateral. Is that more tender there now?
Yes, Stu.
Yep. You need to say yes. How's that feeling there?
Better.
Better? Okay, so come up a little bit more. How's that there now?
That's fine.
Okay, good. More so there?
More lateral.
Yep. More so there? Yep. Oh. Okay, so it's a real wait process. Once again, do not try and hurry through this technique. Just wait for that release to work. Okay. Don't point your elbow. That's the other do not to do. Keep it nice and broad and it eventually will start. If you're pushing too hard, then obviously you're not going to get that release. So you need to really gauge how much pressure. So it's got to be within their pain thresholds, but it's also got to be tolerably uncomfortable. Okay, that's feeling really good. That's really just starting to sink off there. Okay, so we come out. That's all good. So what we can do now from here is we can employ a couple of extra techniques that we can do here as well. So once I've done a release in that area, if it's digital ischemic, then we can come in and actually do some broad massage techniques, okay? So, for Aaron, what we'll do is we'll incorporate a little bit of that anterior deltoid, just because we know he's using a fair bit of that in his rock climbing. Okay. Once again, keep the elbow bent, okay? We want to take that tension off there. What we're going to do is come in with a really loose fist, okay? And we're just going to glide up, okay? We're going to hit almost that anterior deltoid, okay? And as we do so, we're just going to move into a little bit of internal rotation. That'll just bring up that long head of biceps tendon and the bulk of the anterior deltoid at the same time, okay? So it's all about the gliding, not rushing through the technique. That's comfortable,
Yes,
Aaron? Now, because Aaron's only getting this on load, we should be able to try and find that he's going to get some changes once he gets onto the rock climbing face. Great. Simple process, anterior deltoid. Okay, once again, retest them afterwards, see if they have any changes in terms of, once again, their pain and obviously any of the sensations that they get with it. For us, there's another technique that we can do. I'll follow that up in the next video.